Meningoencephalitis. Meningoencephalitis is inflammation of or infection of the brain tissue. Meningitis is inflammation infection of the meninges. Uh, Meningoencephalitis can have different causes and herpes virus infection is the most common cause. Then what are the types of meningoencephalitis? There are several types of meningoencephalitis. Uh, Classified according to the underlying cause, several organisms can cause these conditions. Like in herpes meningoencephalitis, this is the most common form of meningoencephalitis caused by the herpes virus. Second one is fungal, resulting from the spread of fungus through the bloodstream. It tend to affect people who have suppressed immune medications, cancer, HIV. Third one is bacterial. Fourth one is parasitic, and fifth one is secondary meningoencephalitis. This type occurs when an infection starts somewhere else in the body then travel to the brain. HIV, the human immunodeficiency virus, can infect the brain and meninges within weeks or months of HIV infection. Then aseptic meningoencephalitis is this describe a viral and non-infectious causes, and it is usually diagnosed when the CSF that surrounds the brain and spinal test negative for bacteria. Like Japanese encephalitis, this is the primary type of meningoencephalitis in Asia caused by the Japanese encephalitis virus. It is prevented by the vaccines. The main symptoms for meningoencephalitis is the fever, light sensitivity, headache, stiff neck, confusion, difficult in thinking clearly, personality changes, seizures, unconsciousness. Mild symptoms such as fever and headache can be early sign of meningitis. Severe symptoms such as focal neural deficit, continual sleepiness, and seizures may indicate the meningoencephalitis. What are the symptoms like fever, headache, speech problem? Later symptoms in children like vomiting, drowsiness, seizure, behavior change. What are the causes? Causes are viral, bacterial causes like streptococcus, Haemophilus influenza, and meningitis. Transmission through the coughing or sneezing or kissing or close contact with saliva is shared. Most common bacteria for this is Neisseria meningitis. And for viral meningoencephalitis caused by the herpes simplex type 1 and the herpes virus type 2, that is by sexual intercourse, water or food transmission, droplet spread, oral to oral contact. And how to diagnose? We send blood test. This will evaluate the presence of infection in the body. Lumbar puncture. This procedure involves needle aspiration of sample of CSF to check about protein, organism, or inflammatory cell. We can also do CSF culture or electroencephalogram. The test is performed by placing electrode on the scalp that provide a reading on a person's brain wave activity to identify certain brain function. Then we can also do imaging like CT scan, MRI, ultrasound. And how to treat? The main goal of treating meningoencephalitis are to treat the symptoms and the cause of inflammation. The treatment modality different according to type of meningoencephalitis. Some like in most common form of disease like herpes meningoencephalitis, the treatment involves the administration of a IV antiviral medication such as acyclovir for 14 days. Other antiviral medication may include vidarabine or famciclovir during the latter stage of infection. These antiviral medications are less effective medications like medication to prevent seizures such as Dilantin or phenytoin medication aim to lowering the pressure and swelling in the brain such as corticosteroid diuretics, pain medication or sedatives uh, like supervision, bed rest. Other measures are important to prevent worsening symptoms. Like a prognosis are with mild meningoencephalitis, recovery usually occurs within a few weeks of starting treatment, but in severe cases, nearly 50 to 70% of people will develop secondary brain damage. So that's all about the meningoencephalitis.